Hi, I'm James from Chelmsford Dental, and today we're going to talk about dental fillings and fissure sealants. We're going to discuss when you need them, what they are, and how they're performed. Dental fillings and fissure sealants are important procedures that can help protect your teeth from decay and damage. Fissure sealants are used to cover the surface of the tooth to prevent any damage occurring in the future, whereas dental fillings are used to repair damage that has already occurred. A fissure sealant is a protective coating applied to the grooves and pits of your teeth to prevent decay. These grooves and pits can often accumulate plaque, which if left there can cause tooth decay. A fissure sealant is a quick and easy way to protect these areas and to prevent decay from occurring. A fissure sealant is a quick and painless procedure. First, we clean and dry the tooth. Then we apply a solution that roughens the surface of the tooth and helps the fissure sealant adhere. Next, we apply the fissure sealant and we set the fissure sealant using a blue light. Once the sealant has hardened, it helps protect the tooth from tooth decay. When a tooth is damaged by tooth decay, known as a cavity, a dental filling is used to repair the cavity and prevent bacteria from further damaging the tooth. The damaged area of tooth is removed and filled using a white composite resin material. Dental fillings can also be used to fill teeth that have been broken or worn down through misuse, such as through tooth grinding or nail biting. Getting a filling can sound like a daunting process, but the good news is, thanks to modern anaesthetics, getting a filling is virtually painless. First, the tooth and the surrounding area is numbed. Next, the decayed part of the tooth is removed using a dental handpiece. The goal is to leave as much of the natural tooth structure as intact as possible. The cavity is then cleaned and dried before the filling material is placed. The filling material is hardened using a blue light and is then polished and adjusted so that it matches your bite and feels like a natural tooth. If you leave the decay untreated, it can cause more serious problems. The decay can spread, causing further tooth damage and even infecting the pulp of the tooth, which is the living tissue inside the tooth. This can then lead to an abscess forming, which is a painful infection that can even cause damage to the surrounding teeth and cause serious health issues. If you have any questions, please contact our friendly team for any additional information or to book a checkup and keep on top of your dental health.